Life Science Limited, partnering for life.
Hi, this is Dr. Manoj Khanna from Kolkata in India, and I'm going to share with you some very interesting and important information about hair transplant. Hair transplant is the commonest cosmetic surgery in the world today. Both male and female have an equal craving for hair transplant. Of course, females are much less bald than men, and it is done all over the world in huge numbers. In fact, there are some statistics which show that the demand for hair transplant is going to increase 5-folds in the next 5 to 7 years, because people know about the surgery, people are aware what can be done, and know that there are no problems. Talking about problems, many people are scared that the surgery is on the head, scalp, what will happen, there will be a problem with the brain, there will be some complications which will affect the brain, etc. etc. This is absolutely incorrect. The surgery is on the scalp, outside the skull bone. The brain is inside the skull bone. There are no side effects whatsoever. If a child gets a cut on the head, will anybody do stitching? Does there a problem be there with the brain? Not at all, because the surgery is on the skin of the scalp. And forget this, so many celebrities get a hair transplant here and there everywhere. So many film stars have got hair transplants. So there are no side effects whatsoever of a hair transplant. Of course, if you do a hair transplant in an area or with a company or individual which is not qualified, does not know the surgical procedure properly, does not follow proper surgical protocol, there may be complications, which of course can be cured. But if you have chosen the right person, the right surgeon, the right clinic, and gone to the right place, there are no problems whatsoever with the hair transplant. The entire operation of a hair transplant is under local anesthesia. We give you some injection, make the area numb, and do the surgery. You're awake throughout the operation. You're watching television, there's a break, you have your lunch, you're listening to music, there's a coffee or a tea break, and you go home immediately after the operation. There is no staying in the hospital. It takes 4, 5, 6, 7 hours for an operation of hair transplant to be completed, and you need not stay in the hospital at all. You can go back to work the same day or even the next day. I've done many doctors. I still remember a doctor, I finished surgery of a hair transplant at 7 in the evening, and he straight went to the hospital to do duty from 8:30 in the evening. The surgery of a hair transplant, the basic principle, surgical principle, is that when you lose hair, you lose from the front and the center of the head. But the hair at the back of the head, the occipital area is permanent, it never falls. Anybody extensively bald, say Anupam Kher, Lal Krishna Advani, they have lost all the hair from the front and the middle, but not from the back. Because the hair at the back is permanent, if I take hair from there and plant it with its roots anywhere, head, forehead, nose, hand, anywhere, it will stay for life, because the hair root is permanent and will grow like normal hair, need haircuts, never fall. You can comb them, oil them, shampoo them, they will stay for life. Now it's very important to take hair from the permanent hair bearing area and not go outside the permanent hair bearing area. For if you do that, there will be a problem, that hair is not permanent and may subsequently fall. 70% of hair loss is for a genetic reason, a gene in the family. And if you inherit the gene, you lose hair. Many times people will say, my grandmother said I did not use oil when I was young. I had dandruff when I was, all this is wrong. 97% actually is of genetics, and 3% for other reasons like chemotherapy, radiotherapy, infection, anemia, dengue, typhoid, COVID, etc., where these are reversible. If you take medication, the hair will come back. You see, when you're in chemotherapy or radiotherapy, hair is lost from all over the scalp. Dengue, there's thinning all over the scalp. COVID, there's thinning all over the scalp. Medicines short of vitamins causes this fall and will come back when you take the medication. But genetic hair loss is permanent, it doesn't come back. Only 2 medicines work in hair loss. They reduce hair loss, control hair loss, and make the existing hair better. But they don't grow new hair. Lot of marketing, this medicine will grow new hair, PRP will grow new hair. PRP does not grow new hair. The existing hair becomes better, stronger, grows better, diameter is better, but no new hair. If you lost the hair root permanently, the only way is to do a hair transplant. There are 2 techniques of doing a hair transplant, strip and FUE. I will discuss in another video, But let me tell you now that hair transplant is the commonest cosmetic surgery operation in the world, both in men and women. And if you have a problem where you've lost hair and you do not know what to do, there's a good way of getting out of it, feeling more confident about yourself, about your looks. Contact us, let me know. We can do a hair transplant for you and make you get a permanent solution.